Welcome to the latest talk show. This is your host, Leah Richheimer from Yerushalayim. Yay! I'm so excited because a lot of people have asked for this, when you have questions or whatever, to speak with a therapist directly behind the scenes, like what's really going on behind the scenes. So a very warm welcome to Chaya Lieba Kobernick. Thank you so much for being here with us.
Thank you so much for having me.
Okay, so we're going to start. We go very quick, deep dive. Okay, so we're going to deep dive right now. First question I want to ask you is, what is your most frustrating part about being a therapist?
Yeah, I'm really passionate about therapy working to treat mental health problems. And I think this like crazy confusing thing to me that's I don't know exactly how we got here, although I definitely have some theories, but we don't necessarily believe that therapy should work. We believe that if you are struggling with your mental health, you should go to therapy. That's like the responsible thing to do. You should send your child to therapy if they're struggling with their mental health. But we don't actually believe that therapy should work. For example, we believe that therapy is going to take a really long time. We believe we probably, if it's a real mental health issue, you probably have to add medication, but that's not accurate. So for example, just like take your basic depression, antidepressant. So most common antidepressant medication is called a selective serotonin reuptake inhibitor, meaning it helps you to create more serotonin in your system. And serotonin helps you to feel a little better. Okay. But you're not born with the wrong amount. You don't have so you don't have like an imbalance. That just the necessary will create more serotonin in the system. That's it. It doesn't mean that you were born with the wrong amount. Yes, we do see neurological differences. America at least has invested a lot of funding over the last few years in biological markers of mental health of mental health disorders, and we do have biological markers, but the trouble with that research is that the brain is constantly changing. So let's say 8 weeks of mindfulness, the brain could look totally different. So how can you say, oh, okay, so some people are just like born with depression and they just have a chemical imbalance? So yeah, so my big frustration, or my big concern in today's world, particularly in the frum world, particularly in mental health care, is that therapy should work. And what I mean by work is that therapy should treat mental health problems within a reasonable time frame. Yes, some mental health problems will take longer than others, but within a few months to a year and a half, mental health issues should no longer be.
So what's the difference between mental health issue and like, oh, I'm depressed because I wanted life to go this way and it didn't go this way, or I have a sick child, God forbid, or something, whatever. What's the divide?
That's a perfect question. So yeah, we all go through life stressors, right? We all go through challenges and we deserve support through those experiences. We might need to like kind of recalibrate and think about those things a little differently. Maybe we were like a little more rigid in our younger days, and then life gave us challenges that required us to become a little more flexible, and that's really challenging. And therapy can certainly help, with giving us the insight or the skill or whatever to move through those challenges in a healthier way. I think therapy is a nice option in those situations. Along with, there are other nice options. You could also read an inspiring book, go to a great shear, have a really nice mentor. Theoretically, that could work depending on the person, depending on the mentor. You could start like an exercise routine. You could start journaling, meditating, all these things. And therapy is one of those options of what could be helpful when we go through life challenges. A mental health disorder is really like, it is really like an illness. Now I'm not saying that it's like, it's an illness. Let's call it what it is. It's an illness. And somebody who has is having a depressive episode, or who has a personality disorder, or who has an anxiety disorder, or panic disorder, or social anxiety, or whatever it is.
Can I ask you a question? There's a like in my field, I run into a lot of people who have a lot of trauma, whatever. I mean, like almost everybody, like whatever.
Yeah.
I once was giving a lecture. There were tons of people in the audience, and I said, "Who had a dysfunctional, look down so no one can see anyone else. Raise your hand if you had a dysfunctional, you were raised with a dysfunctional family. And like everyone's like, going like, you know, that's it.
Yeah.
Hello, welcome to the world. So the question is, and I don't mean to insult anybody, I'm just saying what we call dysfunctional, whatever, but everyone has something that, you know, or most people have something. It seems to me like if a person has had this kind of thing, they don't fit into the category of mental health illness, and they don't fit into the category of, you know, speaking to their aunt who is really wise. You know, wouldn't therapy be a great candidate to have them, you know, heal from such things in their childhood?
Yeah, when there, yes, this is a very big assumption in 2025. And
What's a big assumption? Which is what?
that if I went through very challenging childhood experiences, then I should go to therapy to heal that. Except there's a big question mark that I have in that sentence, which is heal what?
I would imagine heal the, you know, like let's say your whole childhood, your mother was told you're no good, you'll never amount to anything, whatever. Your whole childhood, you grew up that way. That's, you know, abuse, you know, whatever. I don't know abuse. I'm not an expert in that, but you know, that damaged you. So now you did something.
Damaged you? What? Whoa, what's damaged? What is it? What does damage mean?
It damaged your psychology, so that now you do something beautiful and everyone says it's so wonderful. And I'm like, oh, they don't really know what a
Okay, bam, now we got a problem. You've got a problem. I can help you with that problem. This is not, we are not treating the experiences that you went through. What you went through happened. It's over. It happened. I'm not saying it was okay. I'm not saying it should have happened. I'm not saying
so
get over
how
it.
so
Now
you're different. You differ from other therapists that I've spoke with that talk about, you know, working through it and talking to your inner child and all kinds of modalities that are out there. And you're saying that's not, you don't.
Yeah, and I guess I want to like kind of pause us and say for a second, I know I sound controversial or like I'm saying something really unusual, and this is not what most therapists are saying, and I think that that's a complete and total shame because I am not saying something crazy. If you would go to any like psychological science based mental health conference, I am not special. I am not remotely special. I am
You
not
mean
remotely.
in terms of what you're saying that
What
that
I'm saying is basic. This is basic. This is
you're
not
saying, but in the general world, me, for instance, who just asked the question, you know,
yeah.
you're saying that's a belief system that is proved by science not to be the case.
Yes, it's not it's like a funny I interviewed for for this upcoming summit. I interviewed the top experts in the field of PTSD, meaning the people who literally wrote the top PTSD treatments that have done thousands of clinical trials on these methods. So first of all, I'm just saying it's not new. Stuff has been
Okay.
around since the 80s, okay? So it's
Okay.
not new. I didn't make it up. When you ask them, like, you know, when a therapist says they're trauma informed, what does that mean? They say, I don't know what you're talking about. What does trauma informed mean? Right? When we're saying we're treating trauma, how do you treat trauma? Trauma is an experience. You can't treat it. These are like fundamental things that are weird. We have taken and we have been, I think we have been like really
Brainwashed with the wrong thing.
brainwashed is the wrong thing. I want to say I want but there's like a word I'm looking for, like led along. Like we've been like lied to.
Misled.
Lied,
Misled.
misled. We've been misled. And I'm saying I know I sound like I'm saying something so controversial or so different and like, you know, but I'm really not. It's really not me.
It is very exciting, and we have so many questions coming in. I want
yeah,
to take some of the questions, but
yeah.
what you're saying is you're here to give the message, like, wake up, people. It's not like it was 50 years ago, and we have new modalities that really work and work fast.
Yeah,
That's
and I actually want to say they're not even new. You have been misled and it is unacceptable and it's a shame and I'm sorry on behalf of the field and I have no good explanation as to why this has happened and it's not me. You know, I had somebody said to me like you need to like market your method. It's not my method. I did not make this up. This exists, right?
so,
This has
so why is it so prevalent? The
yeah.
why?
I don't know 100%, but my guess is a few different factors. The people who are doing the research do not have they are researchers, they are clinicians, they are professors. So they're good at education, they're good at research development, so they're good about thinking about how to
Well, do all the
understand
other
others.
therapists, I'm with you there, but do all the other therapists know what the information you just knew and it just hasn't gotten to the.
Necessarily. So not necessarily because of training. So wait, so I want to just finish my point though.
Okay,
The
so
people, these people like at the top, whatever, they are not necessarily equipped to market their
I hear
treatments
that.
in a way that reaches the people. So there's actually a whole field in psychological science called dissemination and implementation science. And what my summit is about is really it's a dissemination study. What we're doing is a really big, I'm now gonna get like teared up. What we're doing is a big dissemination experiment. Can we as a community change communal attitudes so that we can access better quality care? Can you imagine if cholesterol got better quality care tomorrow because we started demanding better and we stopped putting up with this? That would change the whole game. That would change the whole game so
No,
significantly.
I'm totally with you. I hear, I don't have my finger on what the problem is and what the solution is. I'd like
Yeah,
to know that, but by the end of this thing, so that people can
yeah,
actually take action steps that are more effective.
yeah. So the problem is that that the core of the problem is that people are getting therapy that is not um evidence-based first. So I have panic attacks, I have social anxiety disorder, I have OCD, I have PTSD. I have really bad PTSD. I have really, really bad PTSD. I have borderline personality disorder.
But if you just start tuning in now, she's talking about a client coming into her.
Yeah, yeah, yeah.
Hello,
So, like, so
just
whoever
say.
could be I have all those things. That would make life really interesting.
I
But
don't know.
but
TMI, too much information.
but whatever issue, whatever mental health issue you have, I'm not saying the field is perfect. I'm not saying every person who comes to treatment walks out perfect. I'm saying that majority of people start off with standard of care. Standard of care. This is not new. These are not new treatments. They've been around for time. We've really studied them in depth. They really work well for a great number of people. It's a really solid start. And so, yeah, it could be that this modality didn't speak to you. Fine, that could happen. I'm not saying, this is the right answer for everybody, but this is basic. I think a lot of the modalities that people are using, or even sometimes, I think even majority of people are not even using a modality, unfortunately. So either they're using some made up new modality, or they're using no modality. They're doing supportive talk therapy, which is nice, which is nice. And they learn how to hold space, be a container for, have a good conversation, open up difficult topics, but they don't actually treat the problems. They bring people to therapy. That is a tragedy. Am I clear on the problem now? I don't want to blame therapists because I think it's a systemic issue. It's not an individual therapist issue. This is a
Is
bigger
that
picture.
the old-fashioned therapy is still practiced by everybody. It's what the clients expect from their therapist. It's what they were trained in. And you're saying there's a whole body of new knowledge that's science-based that is very powerful and effective. And your mission is to have the clients know that so they demand better care, and that the therapists who don't know these modalities will do something about it and learn it in some way.
Yeah, I want to just clarify a few points. So oftentimes, maybe a therapist is trained in like an evidence-based modality, but they're oftentimes missing like foundational clinical skills that make the treatments work really well. So for example, maybe I'm trained in exposure, maybe I'm trained in DBT even, but I'm missing foundational skills such as assessment, conceptualization, and treatment planning skills. Those are like my core three that I think are missing by a lot of therapists. That without those skills, it's gonna make it really, really hard for me to apply the evidence-based treatment. So that's number one. The other thing I wanted to clarify from what you said is it's not new. This data is old. We've just been
And
developing.
why wouldn't it naturally evolved into the new way? Why wouldn't it have?
So and the things that I think most people are using are actually newer. In a lot of cases, these are newer, and it's confusing why people are developing. I've got this new treatment, and there's so many people who are developing new treatments when we have treatments that work, and the treatments that they're developing are not based on anything. They're based on what they see works, which is nice that you have your clinical experience. But when we develop treatment models, we're developing them based on the existing body of literature, which is so huge.
What's the new, what's this, what's not new, what's this body, what's it called?
Evidence-based practice in mental health care. I mean, it
And you're
depends.
basically, the plan is to get a computer chip and send it to all the therapists and they'll implant it. That's the basic plan here. Okay, we're
No,
raising
that's not the
donations
plan.
for computer
In
chips.
terms of so in terms of like I believe that with this event we could create a supply and demand issue. If people are demanding better care, then that will force therapists to step up to the plate, I think. I hope.
Mhm. Okay, we're going to take some questions. This is very enlightening. Go ahead, Gila.
Okay. So our first question is coming from Suri, and her question is, I feel that my husband and I could use couples therapy, but I feel it's insensitive to divulge all our issues out to a stranger and pinpoint things I find difficult in our relationship. Any suggestions?
Yeah, so that's a great question, but it's a confusing question to me because the job of a therapist is to help their clients. So it's like feeling like it's wrong to go to a doctor and to be inappropriately dressed. Yeah, you are going to be inappropriately dressed if you're asking a doctor to like examine your body or to assist with healing a part of your body. Yeah, if you go to a treatment provider, you're expecting them to help you with an issue, you're going to need to explain the issue to them. Like they're going to need to see those things.
I'm
So
wondering if she's thinking that it's coming from a place of like sharing all her husband's faults in front of him to a stranger.
Blush and
That
horror.
feels
Yeah.
so
very,
that's actually very problematic. Couples therapy is when couples therapy facilitates like focusing on the problems that usually is going to make the marriage struggles worse. That's what I see. Um,
So then what would they do instead?
well, I am not a couples therapist, so I am not 100%
Okay.
like aware of exactly what, what it would look like in
But
session.
airing the dirty laundry, your gut feeling is not good.
Airing the dirty laundry is not the problem. It just has to be really focused, meaning the couples therapist has to be really, really attentive to controlling the amount that is said. So yeah, things will have to be shared, but it's not going to be a vent session because if you're doing a vent session, you are for sure making your relationship worse.
Okay, so Sarah Beal is asking, we've gone through many sessions of couples therapy, but I feel like my husband doesn't actually follow through with the homework. It's like we're paying for nothing. Am I supposed to be grateful he even comes in the first place? Should I quit going or should I go alone?
Well, you can't control him, right? And it's not your business to make him do the homework. It kind of reminds me of parents who get mad when their teens don't do the homework in our skills groups. Like let them have their process, and if they're not doing the homework, then the couples therapist is going to say something about that. No, so let them have their process. You do your thing. Focus on you. Individual therapy is always going to be a great way for you to clear up your side of the street. So you're not going to lose out by clearing up your side of the street and making sure that you're, I was just really like to use that phrase, like that your side of
Uh,
the street is, yeah, you're
yeah.
not going to lose out from keeping your side of the street clean.
So my question for you is, with this evidence-based practice that you're talking about, which is the model you're trying to get the clients to demand more and the therapist to work on more, can you just give us the three top things you would say that people should look out for? So if they like, oh, they listen to the show and they're like, I'm going to go back into my therapist, tell her I want this type of treatment. How will they know they're giving it? What are the three hallmarks of it?
Yeah, so I'll give two parts of the answer. So first of all, we are working as part of the summit. You'll be able to purchase a toolkit, and part of that toolkit will include like a list of questions that you can ask a therapist, so you feel a little more clear and empowered of how to advocate for
Excellent.
yourself. So like we'll give you that, and there's a lot to it. But particularly the first three things that come to mind. So actually, when we talk about like when I first learned about evidence-based practice, one of my first classes in graduate school, they teach it as the three-legged stool of evidence-based practice. There are three things that make up evidence-based practice. Number one is the latest, the most up-to-date science in this area this person's struggling with. Okay. So in order for the therapist to provide evidence-based practice, they have to be aware of the latest and greatest, at least within the last 10 years, science in the area that they're treating. You can ask them about that. Number two, um, Number two is clinician experience. So clinician experience does matter, either their experience or their supervisor's experience with treating this problem. And then number three is client preference. So we actually know one of the areas where I think it's like the clearest that we have to rely on client preference is in PTSD research. We know prolonged exposure and cognitive processing therapy both work really, really well. We don't have data that supports that one works better than the other. We have some data that maybe military people respond slightly better to this one under these conditions, but really not. And so we really know that client preference is the best way to decide how to.
PTSD is post-traumatic stress disorder, just for
Yeah.
people who might not know that. Yeah. Oh, so that it's their preference, whichever one that sort of
Yeah,
feels.
client preference is important in treatment, meaning it's not like, okay, you have to do this thing, or you're a bad patient, you're resistant, blah, blah, blah. No, absolutely not. Your preferences matter as part of evidence-based practice.
So you're saying those are the key things that a person, when they're going in to try and demand this kind of therapy, and they can say those words, right?
Yeah.
Evidence-based practice. Yeah, very good. Okay, let's take another question. Like I see they're flying in here.
Okay, great. So Layla's asking, I guess, something that's on everybody's mind. How would I know if I have a mental health problem? I get down
Yeah.
and snappy, but isn't that just regular feminine moods?
Yes, that's a lovely, perfect, wonderful question. I love it. So, first of all, yeah, you get down and snappy. Congratulations. So do I. That happens. That's totally fine. When do we want to be? So, I always think like a few different categories. There's the category where like I am not functioning, right? I am like lying in bed all day long and my family is starving to death. I don't know what, right? So, that's like, okay, that's like a crisis situation, right? Or like a pure nefesh situation could be happening, right? That's needs intervention immediately. That's a problem. Then there's like middle of the road where I say like that needs treatment, right? If I'm suffering in any way, so meaning maybe I'm not like completely falling apart, my family is functional, everything's kind of moving along okay, but like my moods are so, or my anxiety is so, or whatever it is, it's disrupting my ability to live the life I want to live. So it's really disrupting things for me, then that's a really great time to go to therapy. And then there's I'm struggling with my snappiness or whatever it is, and I want to work on that. Therapy could be a nice way to work on that. But like I said earlier, there could be also many other, you don't have to go to therapy for that. Therapy is one way to work on things. I think we've done ourselves a disservice in this generation that everything has become about mental health instead of, you know, personal growth involves a lot of different pieces. And therapy is one way to work on yourself, but learning Torah is another way, and and exercising is another way, and journaling is another way, and meditating is another way. And that's for real, you know.
That's good. I like the therapy being part of that mix because people need someone to hold hands. It's like if you have an exercise partner and they show up, they knock on the door, you go for the walk. If they call and, oh, I can't come, it's like 9 times out of 10, you're not getting out that door. So it's like there's part of that I think is very comforting for therapy, from therapy. Okay, go to the next question. Very, very good. Good answer. Let's
But
go.
I actually would want to just add a little on that,
Oh,
which
sure.
is that I do think that to me, the issue with that last bit is that it just needs to include informed consent. So I have like a couple of people who continue to come to see me periodically, even though they came with a mental health issue. They resolved the mental health issue. They graduated from treatment, but every few months they come, they see me for maybe a few weeks at a time or whatever. That's totally fine. And they know I am choosing to come to Chaya Lieba for some help and support and hand holding on this issue. Totally fine. But we're not in like active treatment mode, right? It's not that I have to come to her. It's not that I need her. It's that I'm choosing to use her like as like an insightful, helpful, guide along this part of my journey of life because I already have existing relationship with her and I trust her. Good, wonderful. But like that's informed consent, right? You don't need me in order to continue to live a great life. You can go live a great life without me and never see me again and never think about my name again. Or you can use me periodically if you want, but you don't need that. That's just important to me in terms of the concept of informed consent is that to understand like you don't need active treatment.
Rivka's asking, my husband doesn't believe in himself and can't accept respect or compliments from me. He doesn't feel a need to go to therapy. How can I build him up?
Yeah, that's it's I think it's a hard thing to accept. I mean, first of all, I think ask Leia better than me. I'm not an expert in this. But what I would say if I had to say something, I would say we're not in charge of other people and we can't make them. What we can do is we can influence them by our actions. So continuing to compliment them, great idea. Like you do the functional side of things, right? It is functional and healthy to compliment, thank, and be grateful to the person who you're married to. Like that's good. Do it.
Well,
you know.
I think her issue was that he's a bottomless pit. And in other words, whatever his drama that he has, or his life history, whatever he comes to the table with the inability absorb appreciation or compliments or respect. And would that be helped with mental health issues? I think that's what.
Definitely no. So listen, therapy for sure sounds like it would be appropriate, but we cannot force people to go to therapy if they have no interest in going to therapy. I don't think it's useful to try to like keep, arguing with them about that or force. There's nothing you can do about it. You can't make them. If you have an opportunity to make them, maybe that would be helpful, but not even for sure. So I'm not so into like making people go to therapy. It's not like a great option. So I'm saying I worked with families where there's like just a big focus on like, we gotta just get them to therapy. And I'm like, I don't know that that's really the answer here, because what? So we get them to therapy and they're not really able to use it. So much better is you focusing on what you can control and give, which is you do the appropriate behavior, the healthy, wonderful, good stuff, and focus on keeping yourself like supported enough that you have the energy to do that, right? I'm not saying like, yeah, you always have to be perfectly like, doing all the right things all the time, right? Like take care of yourself so you're able to do that. That's hard. And keep your side of the street clean.
And also, there's one thing that if you throw a whole huge dose of humor in there, like it could be, and you have to know your husband well or whatever, but I think this would work with a lot of husbands, which is to say, listen, I know for whatever trauma and drama you went through in your life or whatever, I know you're not hearing this, but I just had to tell you, that was the nicest flowers you ever bought me. I know you're not feeling, I know it doesn't go in. I know I'm just wasting my breath by saying how wonderful you are, but I just had to say that. You'll get a little smile from him. So if you call it like it is, and with the warmth, maybe that'll go in a little bit better, and it might turn the tide, and a tweak 1% of your compliment will get in. Hopefully, it's a shame. Okay, final. What's the one thing you want to leave our viewers with in terms of behind the scenes with a therapist, and what one message that you want to give everybody?
I'm actually going to add on to that for a second. Someone asked, can you share a story or give us all a little hope? Maybe about someone who, healed through therapy.
Yeah. All the time. I'll share somebody recent because that's always fun, right? So somebody I'm working with grew up with a difficult childhood experience, or childhood experiences that really shaped how they relate to the world today. And we just did PTSD treatment, and they are at the end of the treatment, and they've responded really well. And it was so exciting for them to get to the point where they could go through their trauma narrative and not have a lot of increase in like distress associated with the memory itself. And then to also see how that's impacted up so many other areas of their life, where they can talk about other things differently, where they can like, it's not a big deal anymore. For example, they had a hard time maybe with like asking favors from other people, and now they, like, when we went through that list, it's like, well, that's not such a big deal anymore. So that's huge, and it's so fun, and that was within like 8 sessions. So it's so
we just want to thank you so much for being with us today. You were really, really terrific. I think we learned a lot. It was, and it's opened my eyes. So thank you very much for being with us. And Hashem should bench you to continue on your mission and continue to help people in Klal Yisrael. So the homework for this week is to clean your side of the street. One little thing, clean it up. You've been sharp with him. He comes and walks in the door. You don't even greet him. Whatever it is. Clean up one little thing this week. Okay, we'll see you next week. It's Leah Richheimer with the latest talk show. Thank you so much for being with us. Thanks for being with us, Chaya Lieba.
Absolutely. Take care.